Good morning, students. In the last class, we have covered the learning objectives, the terminology related to space maintenance and pediatric dentistry, etiology of and the factors affecting the space loss, indications and contraindications of space maintenance, prerequisites of a space maintainer, classification of space maintenance. Coming to the advantages of the removable space maintainers, it is easy to clean and permits the teeth to be cleansed, maintains and restores vestigial dimension. It can be used in combination with other preventive procedures. The circulation of blood to soft tissues will be maintained as it can be worn part-time. It helps keeping the tongue in boundaries compared to the fixed space maintainers, which will have only a wire component along with the bands. And it stimulates the eruption of permanent teeth by applying pressure. Room can be made for the permanent teeth which are erupting without changing the appliance. The aesthetics, phonetics, and masticatory functions will be maintained with the help of these removable appliances. Band construction is not necessary, and the dental checkups for caries detection is done easily because you can remove the appliance and check for any caries lesions. However, there are certain disadvantages of these removable space maintainers, as it may be lost or can be broken by the child patient. The compliance that the patient may not wear it, that is an issue. Compliance with the wearing of the appliance by the child patient. Lateral jaw growth is restricted because it will have flanges laterally, and also if the clasps are incorporated, it will further restrict the positions of the teeth, that is the movement of the teeth during the growth, and it may irritate the underlying soft tissues. Advantages of the fixed space maintainers are it is easy to fabricate or manipulate. Jaw growth or passive eruption of the abutment is not affected. Compliance will be good because it can be used for uncooperative patient in view of loss, breakage, or failure to wear. Bends are used with tooth preparation or with minimal preparation if stainless steel crown. That is, bends are used without tooth preparation or with minimal preparation if stainless steel crown is used. Subcutaneous teeth are well guided into their position. Masticator function is restored if pontics are placed along with this fixed space maintainers. The disadvantages of this fixed space maintainer include elaborate instrumentation and expert skill, which is needed with this. Decalcification of the tooth around the bands is a problem. Harm to abutment teeth or tooth due to development of torque forces resulting in appliance breakage. There can be supra-eruption of the opposing teeth or tooth if pontics are not used. If pontics are used, there will be interference with the vertical eruption of the abutment, and also it might prevent the eruption of the successor under the pontic if the patient fails to report periodically. The armamentarium which is used for bands, you would be witnessing these instruments in departments of pediatric dentistry or orthodontics. They are stainless steel band materials, band contouring pliers, band forming pliers, band seater, band pusher, band adapter, hoe pliers, straight or curved, and this band cutting scissors also will be used along with the spot welding unit and the finishing burrs. The armamentarium used for loop or arch construction include stainless steel wires, 3-jaw pliers, universal pliers, and wire cutter for loop or arch construction. And for soldering, solder torch, silver solder under flux. For band construction, the materials used discussed in the previous slide. So band material will be used, and there is tooth preparation, tooth separation as a part of band construction. Then molar band preparation will be there, pinching of the upper and lower bands, festoning, finishing, and polishing as required. Different space maintainers used in pediatric dentistry are: fixed space maintainers include band and loop, crown and loop, lingual arch, the palatal arches, which includes Nance palatal holding arch and transpalatal arch, the fixed anterior space maintainers, bonded space maintainers, and other space maintainers. Band and loop space maintainer is one of the most commonly used space maintainer among all the space maintainers. It is a fixed unilateral appliance for space maintenance in the posterior segment when single tooth is lost. The indications are: one, early loss of first primary molar in primary dentition; bilateral loss of single primary molar before the eruption of the permanent incisors; loss of second primary molar after the eruption of first permanent molar; premature loss of primary canines occasionally. The advantages and disadvantages of the band and loop appliance are: the advantages include it is effective for unilateral loss of single tooth in buccal segment, economical and simple in construction, little chair time if preformed bands are used, and nowadays preformed loops are also available, and it adjusts easily to accommodate changing dentition, because it is a cantilever type of appliance with a single band and loop. However, the disadvantages are decalcification under the bands as with any fixed space maintainer, supra-eruption of the opposing two or teeth, because a loop will be there without any pontic or tooth in that position, and it does not restore masticative function because of the loop. Limited for single tooth space. Most of the times, band and loop is applied only for single tooth space loss, but occasionally two teeth space loss also it will be used, but with a lot of disadvantages rather than advantages. Construction of the band loop space maintainer. Band construction are preformed bands for the abutment teeth, and there will be you will be designing a wire loop with a 19 to 20 gauge wire using pliers and a wire cutter. The design of the loop should allow for the increase in the intercanine width, because it should not hold the canines when you are using it for a space of the first primary molar. Width of the loop should be enough to allow eruption of the premolars without obstruction, and the distal ends of the loop should overlap the mesial one-third of the buccal lingual surface of the band just above the free gingival margin to allow occlusal clearance and adequate strength of the shoulder joints. The arms of the loop should run on each side of the ulnar ridge close to or just touching the gingiva but not impinging onto the gingiva. These are the different types of band and loop space maintainers. Here you can observe band and loop space maintainer on the maxillary arch. Here, as I said, it is a long span band and loop space maintainer for two teeth space on either side of the mandible, but rarely it is used. That is before the eruption of the primary incisors. Once the permanent incisors. Once the permanent incisors are erupted, you have to give lingual arch rather than a bilateral band and loops. Here you can see a reverse band and loop on either side before the eruption of the first permanent molars when E's are lost. Crown and loop space maintainer The indications are as good as the bend and loop space maintainer. But however, if the abutment tooth is highly carious, that is more than two surface caries, or it is hypoplastic, or pulpotomized or pulpectomized, that is endodontically treated primary abutment tooth, then you give a crown for the abutment tooth, and loop will be placed. So it is termed as a crown and loop space maintainer. You can see here a crown and loop space maintainer in the mandibular arch. Lingual arch space maintainer, it is used for the space maintenance and also minor tooth movement in the lower arch or mandibular arch. Two bands will be joined by stainless steel wire butting against the lingual surface of the incisors. The indications are multiple loss of primary molars with no loss of space and favorable mixed dentition analysis, minor tooth movements like distalization of the molar or proclination of the incisors in the case of mild space loss. The advantages of the lingual arch include it allows free individual tooth movements while maintaining the space. It will cause little or no inconvenience to the patient, less bulky than the removable acrylic appliances, less conspicuous than other space maintainers, maintenance for more than one succedaneous tooth. It prevents mesial and lingual drifting of molars, lingual collapse of the anteriors, thus maintaining arch perimeter. With stops distal to the anteriors, it can prevent distal dipping or migration of the anterior teeth, and it will allow for the minor tooth movements as mentioned. The disadvantages of this lingular space maintainer include decalcification as with any other fixed space maintainer under the bands, soft tissue damage due to embedment of the archway, more often in patients with poor oral hygiene. It may be distorted by the masticatory forces and move teeth to undesirable positions. Construction includes band construction or preformed bands. Archway should be located 2 millimeters below the gingival margin of the edentulous ridge all along the posterior region to prevent distortion due to masticative forces. As I mentioned, it should butt against the lingual surface of the anterior teeth just above the cingulum, soldering at the mesiolingual cusp in the middle third of the band for the loop posteriorly. Modifications to allow intercanine with changes for band and loop appliance or lingual arches, you can see there can be easy allowance of the lateral shift of these canines during major intercanine with changes with this type of modifications in the band and loop or band and bar or a lingual arch appliance or a removable appliance. This is given by Rapp and Demirogen 1983. Palatal arch appliances. One is transpalatal holding arch. It is a maxillary lingual arch that does not contact the anteriors but approximates the anterior palate as shown here. And the palatal portion approximates an acrylic button, what you observe with this arrow here, acrylic button, which provides resistance to the anterior movement of the teeth. Indications like lingual arch, the indications are the same, but it will be for the maxilla. Also, if the stress maintainer is combined with a habit breaking appliance, habit breaking thing, you can actually include some spurs or spikes in this acrylic button, and it can be used as a habit breaking appliance also along with the space maintenance. The disadvantages: soft tissue irritation due to this acrylic button, hypertrophy if the oral hygiene is not maintained well. Other palatal arch appliance is transpalatal arch. It is best for the unilateral loss of multiple primary teeth with other side intact. As you observe here, one side the teeth are intact, other side two teeth are missing. So this type of situation, you have to give a transpalatal arch. It is with the two bands and with a horizontal wire with a U loop the design for minor tooth movement or adjustment of the teeth if it is required. Distal shoe space maintainer is one of the critical space maintaining appliance, which is otherwise termed as intra-alveolar appliance or eruption guidance appliance. This you have to remember because the question can be uh, synonymously asked for the distal shoe space maintainer as an eruption guidance appliance because it guides the eruption of the first permanent molar when E space E is lost and given as a space maintainer for the E space. The earlier designs of this distal shoe space maintainer used to have cast gold or Willet's distal shoe with a bar type of extension into the alveolus, whereas the present design is termed as Roche design or Roche's distal shoe or its modification using crown and band with a distal intra-gingival extension, which is in V-shaped and offers broader surface and helps in preventing rotations. It also holds a greater chance of for the unerupted teeth positioned buccally or lingually in the dental arch. The indications for distal shoe space maintenance are loss of secondary molar before the eruption of the first permanent molar. This is the indication. The contraindications are inadequate abutments, poor oral hygiene, and medically compromised conditions such as congenital heart disease, kidney disease, juvenile diabetes, or history of rheumatic fever, generalized debilitation, hemophiliacs. In these cases, it can cause more harm than uh, help because it is an intra-alveolar appliance or a invasive appliance, which will be the distal end will be placed into the extraction socket to guide the first permanent molar into occlusion. So in these cases, it is contraindicated. In case of congenital missing first permanent molars also, which is a rare condition, these are not indicated. The path of eruption of first permanent molar in the mandible it is mesial and lingual, whereas in the maxilla it is distal and facial until it meets muscular resistance, then mesial until contact with the second primary molar. So accordingly, the distal extension will be placed to come in contact with the erupting molar so that it will be guided normally into occlusion. The fabrication is band or crown over the first primary molars. Then position of the distal extension of the loop for mandibular arch slightly lingual. For maxilla, slightly facial position according to the direction of the eruption of the first permanent molar over the crest of the alveolar ridge and should be wide enough to make contact with the erupting tooth. And the length of the distal extension, it will be according to the distal width of the second primary molar on the opposite side of the arch. Need not be extended up to the mesial surface of the first permanent molar. And the depth of the distal extension, it is not too long to prevent damage to the erupting first permanent molar, but not too short also, so that the erupting first molar erupts underneath the appliance. So it should be 1 mm below the mesial marginal ridge of the erupting first permanent molar. That is 1 mm below the mesial marginal ridge, so that it will guide properly into position. The other fixed space maintainers are bar type space maintainer. According to Indian 1962, a bar will be touching the next tooth in the arch, restoring the formal contact point. The bar bent to an S shape before touching the next tooth, and a bar attached to the next tooth through the ring shoulder to a band or crown. The other type is bonded space maintainer. Here you can witness the bar type of space maintainer. This is one which will be contacting the opposite to mesial distal surface. Here it is a S-shaped curve which will be contacting the distal surface of the anterior tooth. This is the appliance in the position. This is another bar type of space maintainer with crowns on both sides of space, that is abutments, and a stainless steel bar will be attached through a vertical tube, and on the other side it will be shouldered as a ball and socket joint. You can witness bonded space maintainer, because I mentioned in the classification either they can be fixed space maintainers can be bonded or banded. So these are the different types of bonded space maintainer. Here only stainless steel wire is banded. Here rebond is used instead of stainless steel wire for bonding between the two teeth. Here is a composite or a rebond loop which is used to bond the same. Here the stainless steel crown is cut labially for creating aesthetics, and also a bar is used for bonding. Fixed space maintainers in the incisional area, they can be fixed bridges or cast overlays. Aesthetic anterior space maintainer is the other choice. An aesthetic self-adjusting anterior space maintainer according to Robert. The anterior aesthetic appliances according to Groper 1984, which can be used by means of open-faced stainless steel crowns or solid direct bond pad with mesh base. Here you can see a Groper appliance for the maxilla with two bands and a lingual arch, for which orthodontic brackets are soldered, to which acrylic teeth are attached. The removable partial dentures, and the other types of removable space maintenance can be removable Hollis appliances. The space regainers, when space is progressively lost due to space closure after premature loss of primary teeth and failure to place a space maintainer, we have to use space regainers. And proper diagnosis and planning is necessary not only for the posterior segment but also to the entire dentition. We'll be needing diagnostic cards or study models, radiographs, that is periapical and bite wing radiographs, lateral cephalometric radiographs, and we might be needing a mixed dentition analysis by means of Moyer's mixed dentition analysis to plan for regaining the space. The mode of action of space regainers are tipping or bodily movement of the teeth which moved into the space, and distal or mesial movements, and overall alignment considerations. The fixed space regainers are band and loop with open spring. This is the appliance. Jeffy appliance, Gerber space maintainer or regainer, Hod's lingual arch, sectional arch appliance, lip bumper, anterior space regainers. This is how the Jeff appliance will be there, band and two wires with a sling in between and the springs, so that this closed spring will be slowly open, and it will move the teeth into positions. You have to keep on changing this horizontal sling. Gerber space maintainer or regainer will have something similar to band and loop design. Only thing with the loop which can be adjustable with the springs, this tubes attached to the molar bands. So it will serve dual purpose. Once we open the space with the help of these loaded springs in the tube, then it can be maintained in the position to maintain the space. So that's why it is mentioned as Gerber space maintainer bar regainer. What's the lingual arch is similar to the conventional lingual arch, but only with the U loop provision in the lingual arch visual to the molar region. And also it can the arch can be removable with the slots attached to the molar bands. So by activation of this U loop, minor tooth movements can be uh, possible so that the space can be regained. There are some removable space regainers that termed as free and loop spring split block or split saddle type of space regainer, fixed loop spring space regainer, slingshot space regainer, jack screw type of a space regainer. Free and loop spring has label archware for stability and retention. Back action loop spring with 0.025 wire and acrylic base, and movement of the tooth is achieved by activation of the free end of the loop. This free end of the loop will be activated. This one for maxilla, and here it is for the mandible, so that it will move the visualized tooth distally. Split block, you can see the block there. There will be U loop which will be attached to the block which is split, and by activating this U loop, space will be regained. So the functional part of the appliance consists of an acrylic block split buccolingually and joined by 0.025 wire in the form of a buccal and lingual loop, and activated by periodic spreading of the loop. Fixed loop spring, it differs in the loop spring activation, resists breakage, and provides satisfactory movement of the tooth distally. Slingshot, it, this is the design of this slingshot. Consists of a wire elastic holder with hooks instead of wire spring that transmits a force against the molar to be distalized. The distalizing force is by the elastic stretched on the middle of the lingual surface of the molar to be moved. The other is arranged on the buccal surface of the molar. The elastic is placed when the appliance is outside the mouth. Here, elastic is placed to this wire from here to the lingual side. One more wire component is there, like this type of hook. So outside the mouth, the elastic is placed, and when you place the appliance inside the mouth, this elastic which is connected to this buccal and lingual hooks will actually distalize the tooth, and this elastic can be changed every day. These are the jack screw type of expansion type of space regainers. This one type of design, this is the other type of design. With this, we come to the end of this topic of space maintainer. Thank you.